This podcast is intended to provide information for educational purposes only and to serve as a starting point for you to have a conversation with your personal physician. Nothing stated on this podcast should be considered medical advice. Consult with your physician before undertaking or changing any treatment plan.
What do you want everybody who's about to have a psych eval to know?
Right, that it's not about passing or failing. I actually just came up in a support group today with post-op bariatric patients. They were talking about their psych eval and how they looked at it as so performative and they had to just give the right answer. And that made me so sad because I'm like, that's not the purpose of the psych eval.
Laura, you and I go way back, huh? We're both Michiganders.
We are Michiganders.
Yeah,
Yes.
what practice did you work for in Michigan?
I have always worked with, well, it's Grand Health Partners now, but even before that, it was MMPC. So, I go way back to 2003. So Dr. Kemeter, Dr. Baker, that whole group.
Yeah.
So I worked with them for 18 years before going completely into private practice.
Yeah, great surgeons. It's a great group. They really have a fantastic practice there on the west side of the state, and they're nice people too.
Yes, and they have a strong behavioral health component to their practice, which I love, and I thought every practice had that, and I've now learned that they don't. So
no, it's the exception. I mean, I think even we don't necessarily have that strong behavioral health.
We know the value though.
Yeah, for sure. So talk to us just about, what's your career been in the bariatric space? I mean, what services are you providing? What have you been offering our post-op bariatric patients?
Well, it's hard to believe. I was thinking about this. How long have I been in bariatric space? So I can always tell it'll be 21 years next month because I just had my first child who's now 21.
Wow.
So that's how I can always tell. And I was hired in the group that we had just talked about to do groups, behavioral education groups with medical and surgical weight loss. So they had both programs. So the practice I work with has been doing medical weight loss forever.
Yeah.
So I did facilitated support groups, but we even went a little bit deeper and we every other week taught these behavioral education topics to our patients because my passion as a bariatric therapist is there are different ways people are choosing to treat their disease of obesity. My role is the same. You still need to figure out why you eat. You still need to do what I call is the head work. So yes, I did some of those pre-op behavioral psych evals, but I was much more passionate about working with our patients as they were after bariatric surgery, doing the group work with them. And then also I had a private practice where I was doing individual therapy. And so of course, would start then seeing bariatric patients who needed therapy. So that's been going for a long time. And it used to be, like I said, on site in the surgical center. So it was kind of one-stop shopping for our patients. And then COVID happened. And I think we all started thinking about how can we do things differently. And right before COVID, one of the things I forgot to mention is I'm also, I started doing some public speaking for providers and patients. I felt really passionate about getting this message. I still feel what I call head work, many people call mindset work, is the missing piece of the bariatric surgery plan. And I spoke at an obesity help conference, I think in 2019, because it was before COVID. And I was just teaching basic behavioral education things about emotional eating and changing our thinking. And there were 700 bariatric patients there. And it was like I was almost giving them water or air. They had never heard it before. And that just started my passion to like, okay, I need to get this message outside of Grand Rapids, Michigan. And how can I do that? So I created and launched an online course of headwork skills, foundational headwork skills. Then COVID happened. So it was like the perfect timing for me to do an online course because everything went video. I didn't know that was going to happen, but it did. And just felt, called and ready to reach more patients outside of Grand Rapids, Michigan. And the surgeons gave that blessing as well. And so now I work with bariatric patients really around the globe. I'm an expert in the Bari Nation community. So that's where I support patients and leading several support groups a week there. I do podcasts like this. I'm coming to you from my brick and mortar office in Grand Rapids, Michigan. I still have a practice where I do individual therapy and coaching. So that's a little bit about my experience the last 21 years almost.
So I think, some question, a lot of patients have a lot of anxiety and are nervous about their pre-op psych eval. You've probably done that a few times, right?
Oh, yes.
Yeah.
Mm-hmm.
So what should a patient who's going to have a pre-op psych eval expect? What's the benefit of these evals? And, so what do you want everybody who's about to have a psych eval know?
Right. That it's not about passing or failing. And actually, this is such a important question because it actually just came up in a support group today with post-op bariatric patients. They were talking about their psych eval and how they looked at it as so performative and they had to just give the right answer. And that made me so sad because I'm
Yeah.
like, that's not the purpose of the psych eval. So when I'm doing a psych eval, what I say to the patient is, you know what? First of all, I want to let you know it's not pass or fail. I'm here to get to know your story. And I'm also the provider that's spending the most time with you before bariatric surgery, meaning I get an hour, right? Our surgeons, our mid levels, our dietitians, they're not getting an hour with patients before bariatric surgery. I get a whole hour with them. And I said, it's my job, just like your surgeon and if you have an obesity medicine doc, they are making sure you're medically ready. They may order some things like you need to have a cardiac clearance or you need a sleep study. I said, it's my job to make sure you're psychologically ready. And all we're doing is I'm making sure you have all the psychological tools that you're going to need to have success because you want to lose this weight and keep it off more than I want it. Right. And so I want to help you. And if you need more tools, so that's where we're kind of going, the Psych Eval. I always tell patients, at least how we have been doing it here in Grand Rapids, and I think this is pretty standard, is we kind of had like a green light, yellow light, red light.
Hmm.
And most of our patients were green light, right?
Yeah.
We know our patients are coming to us with this serious disease of, morbid obesity with comorbidities that need to be treated with bariatric surgery. So we're making sure there's no active, you can have a mental health diagnosis. Many of our patients do, but we have to make sure it's stable, just like you'd make sure other health conditions are stable. Um, so we're assessing for that. So the yellow light, what would be, most of our patients are green light. So yellow light, and well, maybe I should start with the red light. So red light is going to be like active suicidality. I mean, these are like big concerns. So I
Right.
want patients to say what to know for the psych eval. We're not going to fail you because even if someone is coming with some active suicidality or active psychosis, it's not time for them to have bariatric surgery. It's not time for them to have any surgery. It's time for them to get that taken care of. And that's really, really rare.
Yeah.
At least in my experience.
It's like active suicidal thoughts, active substance abuse, right? I mean, it's red flags, right? Am I missing anything?
No, because
Yeah.
even our our patients who present with um, uh, binge eating disorder
Right.
and symptoms of binge eating disorder, I would still put, and this is my assessment, in what we would call the yellow light,
Right.
and that was to stop your surgery, but we're going to recommend you get into some counseling along with. Like, let's do this concurrently. Because again, we're building your toolbox for you to have success.
Yeah. And binge eating disorder does not get worse after bariatric surgery. It often gets a little bit better, correct?
Right. It can get better. I think there's a lot of reasons for that. It also can look a little bit different
Yeah.
after bariatric surgery, or maybe patients didn't realize they had it until after bariatric surgery and they can't do what they did before. So
Yeah. So I think that's a great point, which is that it really takes quite a lot to kind of, as you say, fail a bariatric psych eval. Um, and so I think, the kind of next question there is, so what should you be doing after surgery? Like I had surgery, and I've always, I think just like you, this has always kind of bothered me. It's like we front load all the emotional work when really the value is probably on the back end.
The long-term, skills.
mm-hmm. Yeah. So one of the things I was really pleased about when I attended the most recent ASMBS conference, I forgot to mention that I'm very involved with ASMBS and serving on their surgical or support group committee, so not surprised there. But the message was getting out. This last meeting we had in San Diego this past June is our interventions, like from the psychological perspective, the head work perspective, are much more effective post bariatric surgery. And we need to be building up those interventions for our post-op patients, knowing that obesity is a chronic disease that needs lifetime treatment. And what I've seen is that, so you asked the question, I would like to see patients obviously in support group. I think that's the basic intervention, right? Like you need to be with other patients. You have a wonderful team, but that of your surgeon and your dietitian, and maybe you do have someone like me, a bariatric therapist on your team, but you need other patients where you can go and you can talk about things, where someone can say, I understand how you feel. You're not alone. I often say community is treatment. Just like getting your protein in, our patients need community. I'm very passionate about the behavioral health education. So making, if our clinics could start offering, like they do here in Grand Rapids, topic groups on emotional eating, cognitive behavioral therapy, and weight management. I did a presentation. You talk about substance use disorder, food to booze, understanding your risks there. And of course, I believe in what I do. So I'm going to encourage everyone to be in some individual therapy if they're willing, because I think it's a wonderful way to self-care. Our patients have had a relationship with food, put in your age. If they're 45 when they're having bariatric surgery, they've had a relationship with food for 45 years. And it may have been an unhealthy relationship. They may have been using food to cope. It works. It's not the best coping skill. But in therapy school, we learn you don't remove someone's unhealthy coping skill until they're ready, right? You've talked about it, they've recognized it's a problem. You're going to practice some different things. We'll try this. You don't have the benefit of that, Dr. Weiner. When you do your job, that relationship is severed, right? And so the breakup happens, and individual therapy can be a place where they start learning more about their emotional relationship with food, which back to why more post-op intervention. Patients always say to me, man, I really didn't know how much of an emotional eater I was until after surgery. Or as in group today, someone said, how did we know what we didn't know? Right? Like pre-op, they're getting hit with so much information. They may hear us talk about emotional eating or head hunger. They're like, oh, yeah, I'll be fine. So support group, education, behavioral education, and then obviously if you can go into therapy. And it doesn't have to be a bariatric therapist. I've had that question asked. We're growing, right? There's more of us like popping up in this niche, but I think any therapist knows how to work with our patients on developing healthier coping skills and what I also call healthier um, affect regulation skills. Our patients need to learn how to feel their feelings in healthy ways.
So, what other sort of emotional barriers or challenges do you find patients running into specifically after surgery?
Well, I think I alluded to it a little bit, but I'm so glad you're giving me the opportunity to expand. Um, I think to answer that question, oftentimes I've learned the most from my patients through the years. And I often will ask the question, whether it's pre-op or they're starting in therapy, what role does food play in your life? And I'll hear things like, food is my friend. Food is always there for me. Food accepts me the way I am. Food is with me when I'm lonely. Food is fun. Food is my therapy, right? Food is how I cope with anger. And so you're already starting to hear that changes, right? Like you can't eat, especially in that first year, the way you used to eat. You cannot rely on food psychologically. And so patients often will feel, what do I do? What do I put in its place? Um, what are these feelings? I think they start feeling feelings for the first time. Um, when I will often do, whether it's at Berry Nation or it was back at the Grad Health Partners where I worked, we would do quarterly a group for family and friends, like the support people. And they would say, why is she so crabby? Like, why is my loved one so crabby all the time? I thought this surgery would make her happy. And I start talking and educating. So back to the emotional barriers, when it comes to uncomfortable feelings, none of us like to feel them. But our patients before surgery, on a scale of 1 to 10, 10 being highest disturbance imaginable, when it comes to a feeling like anger or loneliness or shame or sadness, they maybe let themselves get to a 3, and then they soothe that feeling with food. And then after bariatric surgery, you can't do that anymore. So patients and their loved ones are starting to see more actual feeling of the feelings. Um, so I think it's that. I think, again, so emotional eating is a big one. I think that's a big one. And in that, it's always, wow, I just always thought I was hungry. I have these feelings I have to pay attention to, and what are they telling me? Um, Working on their thinking, right? Every behavior is driven by a thought and an emotion. I'm very trained in cognitive behavioral therapy strategies, and our thinking has a lot to do with our behavior. And so helping patients recognize thoughts that haven't been helpful to them, like, well, if no one sees me eat it, it doesn't count, or I'll just start on Monday, or I've already blown it, so I might as well blow it big. Those aren't cut out of you in the operating room. So having to work on those thoughts and decreasing their power. Um, Another theme that comes up, and actually just came up in a support group today, was learning to put themselves first. Our patients are yes people. They're the everything to everyone. They're the don't rock the boat. I want to make everyone happy. Yes, I'll do it. Yes, I'll do it. Yes, I'll do it. And their decision to make have bariatric surgery is one of the first times they said, wait, I matter and I'm essential. And so this whole idea of setting healthy boundaries is something they need to work on. One of the classes that I teach in my online course is, could your yes be sabotaging your weight loss? And so teaching our patients that, one, they're worthy enough to say no, but then how to say it and set healthy boundaries, and how to deal with the people in their lives who are not going to like the boundaries that they're setting.
So Laura, you've been kind of working in the metabolic space with bariatric surgery for 21 years. Now we've got these new GLP-1 meds. How are they different? How are they similar to bariatric surgery? Are you seeing the same kind of things that you saw with surgery, the same emotional challenges? Where's the head work on these with these GLP-1 meds?
So first of all, Dr. Weiner, I have to give you credit. You are the one who originally taught me at an ASMBS conference a lot of information about the GLP-1s and
Okay.
how they work, and up and coming. And I jumped in and I was really excited to see that this was another tool um, coming down the pike, if you will, to treat the disease of obesity. Now, we could do a whole nother podcast on access to this tool and getting coverage for this tool. But when it comes to my role, it's exactly the same,
Yeah.
right? It's they still have to work on their emotional relationship with food. They still have to work on their thoughts. They still have to work on setting healthy boundaries, building and using a support team. These are all head work skills. You're still one I didn't touch on yet is what I call bariatric grief, right? Or we could call GLP-1 grief. You grieve your relationship with food. There's loss associated with bariatric surgery and GLP-1s that's not just weight loss. Your social life is going to look different at a restaurant. You're not going to be able to eat like you used to eat. Um, and being prepared for that and helping patients know that that's a normal part of the process. Now, in terms of, and maybe Dr. Weiner, I'd love to hear what you think on this. So many of our patients, I mean, there's a lot of reasons why our patients were not seeking out bariatric surgery. But one of them I would often hear is, I don't want to do something permanent to my body,
Yeah.
which we could talk about that. For other medical conditions, we have no problem doing something
Right.
permanent to our body. So maybe when it comes to um, readiness to change and readiness to be open to interventions, patients may be more open to a GLP-1 than bariatric surgery. Again, we have to get them covered. And I think we have a lot of education to do about obesity being a chronic disease and that they need to stay on it. So that may be another thing that educating about, like, okay, we want you on this, but you're going to have to be on it for the rest of your life for it to have the effectiveness. And then I'm also, I loved how you said lurking in the bariatric space. And I have been, because it's also been really rewarding for me to see bariatric surgeons open to, like, this is a complex disease, and we still may need to use another tool when patients struggle with weight recurrence. And I'm like, yes, right? And so that's another use of the GLP-1s. But again, my role is the same. You can choose the how you're going to treat the disease of obesity. I'm going to help you with why you eat.
Do you find, or what is your experience, and how do you find that weight reoccurrence, as you mentioned, or weight regain affecting people, whether it's post GLP-1s, post surgery, and how do you help support people through that specifically?
So we know it's our patient's number one fear,
Sure.
right? Number one fear. So we just talk about the elephant in the room. And a lot of work, and I also say, so I used to teach a topic when I was first back in the day teaching in the surgical center. It was, the name of the topic was called relapse prevention. And the more I learned about the disease of obesity, I thought, this is the wrong title.
Yeah.
With a chronic disease, we're going to have some relapse. So let's change that to relapse management. So I'm very honest with my patients. I say, you may think I'm a Debbie Downer, but there's a strong likelihood with a chronic disease of obesity, you could struggle with regain, right? And we just need to be ready for it. We need to know the signs for it, and we need to know the treatment for it. And I also try to bring their anxiety down about it. I said, you're not going to gain all your weight back, like by tomorrow. And so what I do with them, it's actually a cognitive behavioral therapy technique. I do this in my support groups. I do it in my individual sessions for when that thought comes, because I call it the stinking thinking, like, oh, this is the beginning of the end. The scale goes up. Yep, see, bariatric surgery wasn't going to work for me.
Yep, just
of
like
course
everything
I stopped.
else. Yeah.
So we create what's called a this time is different list, or this time is different response card, to talk back to that thought, because you feel like you're failing. You feel like it's the beginning of the end. But let's look at the facts. So our patients, this time is different card could be, this time is different because I have the best tool on board to lose weight and keep it off. Hands down, empirically proved bariatric surgery.
Yeah.
This time is different. I'm on a GLP-1. All the data that shows us.
Right.
This time is different because I have a support team. This time is different because not only do I have a support team in my team at the surgical center, I have a support group that I'm involved in. This time is different because I'm doing the head work, right? And so you start listing all these things. So on those days where those thoughts become overwhelming, you can talk back and say, no, I have a lot of data here as to why this time is different. I'm not going to gain it all back. And I have a choice in that matter. And that seems to give patients a lot of hope.
I think that's a really great actionable exercise that our listeners can do as well, and a little tidbit to take away and start to implement as their own little homework for today. So I really appreciate you sharing that. I think that's great.
So Laura, if someone's out there and they want to learn more about cognitive behavioral therapy, and maybe they want to look at some books or something like that, where should they start? What would be a great place to get started if people want to kind of just learn a little bit more about what's out there to kind of help a lot of this help their relationship with food, help the head work, right?
Right, helps head work. So absolutely. So CBT, I will recommend the resource where I was trained. It's called the Beck Weight Management Institute out in Pennsylvania. And Dr. Judy Beck, her dad was Aaron Beck. So we kind of all know the Beck Depression Inventory.
Sure.
He was the father of cognitive therapy. His daughter is now in charge, and then her daughter went into it. So all that to say, they have a whole Beck Weight Management Institute and some books as part of their program. I don't love the title of her first book. It's called The Beck Diet Solution, Train Your Brain to Think Like a Thin Person. I don't even know if she would love it, as I've gotten to know her at trainings. So I just tell patients to take that cover off, because I don't like the word diet, and thin people need to work on their thinking too. Not just our patients with obesity do they have to work on it. So
Right.
I still think that's her best book that she's written, because it has all of it in it. And it's not a book you read by the pool. It's a program.
Right.
I also have an online course where I do 2 sessions, 2 CBT sessions, just kind of dip our feet, introduce patients to that.
Where can we find that course?
Just LoraGrabow.com. I'd love for your listeners to go, check it out. I can actually offer, if you're interested in your notes, a 30% discount code for your listeners. We could run that. I have no problem doing that, because again, it's my passion to reach as many patients as I can. That's again LoraGrabow.com. I just redesigned and relaunched, so I'd love to have more eyes on it and hear people's feedback. As far as emotional eating, I think there's a lot. Again, my course addresses that. I like Dr. Susan Elbers. She's a psychologist out of the Cleveland Clinic. Has written 2 books. Well, she's written a lot of books, but the ones I often use, 50 Ways to Soothe Yourself Without Food, and then 50 More Ways to Soothe Yourself Without Food. So I always say to my patients,
way to get 2 book sales instead of 1, huh?
right? I think to tell your patients there are at least 100 other ways that you can soothe yourself without food. I know it doesn't seem like it, but what I like about those books is they're actually something you could just pick up and do the activity right then when you're struggling with an emotional eating urge. So I recommend those as well.
All right. Well, thank you so much for your time, Lora. I mean, I think this is just such a wealth of information. I learned a lot here. I'd encourage anybody listening who wants to learn more about CBT and do some of their own head work to go to LoraGrabow.com, LoraGrabow.com, and check out her online course. Let's do this again. I think this was a great conversation. I think this is a message we haven't really been exploring deeply enough on our podcast. And I think we need to dig into this a little bit more. I have 5 more questions I want to ask you. Yeah. We're out of time.
Love to come back.
Absolutely.
Yeah, I believe in your work. You're doing good work out there in Arizona.
Thank you.
And you have more sunshine than Michigan.
Yeah, but it's really hot right now. Even in this room.
Especially right now in here.
Yeah, we got to turn off the air conditioning because of the recording, and it gets very hot. So I don't know how people did it before air conditioning.
Yeah,
I mean,
anyway. It's hot.
All right. Well, Lora, thanks so much. Thanks to everybody out there listening. And please check us out on social media. Please check out Lora's online course. And we will catch you next time.